Hello friends, this is Dr. Rishika Mehta. I am a pediatric cardiologist from Narayana Superspeciality Hospital, Howrah. Today we are going to discuss a very important thing, that is, what are the basic types of congenital heart diseases in children. So we've always heard that in adults there are some valve problems, heart block, this, that, blah blah. But what are the heart defects in children? We have to discuss that. So heart defects in children are a little different. Basically, congenital heart defects are divided into two parts, that are the blue babies and the pink babies. So first we'll be talking about the pink babies. So pink babies are those babies which have heart hole. In simple language it is called hole in the heart. But it seems to be very simple, however it is not that simple. Hole in the heart can be different, as in there are four chambers in our heart. So the diseases which are in the upper two chambers of the heart are called as an ASD, that is an atrial septal defect. Diseases which are in the lower chamber of the heart are called VSDs, that is ventricular septal defect. And there is another hole which is called a patent ductus arteriosus, which is basically a hole outside the heart. That is a connection between the pulmonary artery and the aorta, which is present in all the children at birth, and it usually subsides after 3 days. If it does not subside after 72 hours, then it remains patent and it causes a load on the heart. So these VSDs, ASDs, PDAs, these are called the acyanotic heart disease, that is where the children are pink, they are not blue, but they have multiple symptoms like recurrent cough and cold, babies don't grow well, they have a lot of sweating, they catch up recurrent chest infections. These are our pink babies or the acyanotic heart disease. Similar to an acyanotic heart disease like ASD, VSDs and PDA, there are some complex heart diseases which are also acyanotic at birth, like truncus arteriosus. That is when usually from the heart there are two arteries which come out. From the right side of the heart is the pulmonary artery which supply our lungs, and from the left side of the heart is the aorta which supplies the whole body. In truncus arteriosus, what happens is there is only one great artery that origins from the heart. So the same large artery supplies both the lungs and the heart as well as the body. This is called a truncus arteriosus. That is also pink. That is the acyanotic heart disease which is present at birth, and slowly this acyanotic heart disease converts to cyanotic heart disease when children grow big if they are not treated at time. So ASD, VSDs, PDA are the most common congenital heart diseases. Apart from it, there are some cyanotic heart diseases where the children are blue. Blue babies mean when the baby cries, it becomes more blue. Sometimes in the nails or on the lips, the baby seems to be blue. And this blueness increases when the child is very cranky or cries a lot. So some parents complain to us that the child is very blue. Sometimes the child on crying becomes so blue that it loses its consciousness. That becomes a life-threatening situation. So these are blue or the cyanotic heart diseases. As I told previously, that there is a pulmonary artery which supplies the lungs from the right side of the heart. So mostly in blue babies, what happens is that the pulmonary artery becomes narrow. So the most common cyanotic heart diseases is tetralogy of Fallot. That is where there is a large VSD, as I told in my previous progression, that there is a hole in the heart between the lower two chambers. Along with it, the pulmonary artery becomes very small. So what happens is, with the large hole, a small pulmonary artery, there is very less blood which goes to our lungs. That's why these children become blue. These are the cyanotic heart diseases. That is tetralogy of Fallot. And similar to tetralogy of Fallot, there are also those diseases where children are blue, like TGA. TGA is transposition of great arteries. In simple language, we say that the heart connections become opposite. That is, as I said, that there is the pulmonary artery which supplies the lungs arises from the right heart, and there is aorta which arises from the left heart which supplies the whole body. So what happens in transposition of great artery is that these connections become opposite. That is, from the left side of the heart arises the pulmonary artery, and from the right side of the heart arises the aorta. So what happens in this is that there is no proper purification of blood, because the pure blood goes into the lung and the impure blood goes into the body. So what happens is that there is absolutely no purification of blood which happens inside the lungs, and for that reason these children are blue since birth. These children are very blue right from the birth. There are few diseases which also lie in the category of cyanotic heart disease. Those are like critical pulmonary stenosis or pulmonary atresia. So while we start from a neonate category, that is when the baby is just 1 day old, if those children are very blue, there are few diseases which have to be treated right there and then. That is like pulmonary atresia. Pulmonary atresia means that there is no original pulmonary artery which arises from the right side of the lung. And as I told that there is a patent ductus arteriosus which is a connection between the aorta and the pulmonary artery. That is the connection which remains patent, it does not close, and from the aorta the blood flows to the pulmonary artery, and that connection serves to supply the lungs of the child. That is called a duct dependent pulmonary circulation. These children are very sick, very blue, and they require intervention right at the birth, maximum to maximum at 1 month of birth, because if this ductus arteriosus closes, there will be no supply to the birth and child cannot survive. Similar to this pulmonary atresia is a severe critical pulmonary stenosis. That is, the pulmonary valve is so small that it is not able to supply the pulmonary arteries or the lungs. In that case, a balloon pulmonary valvuloplasty is to be done to open that valve so that the valve opens and the blood flow from the right side of the heart to the lungs is established. This procedure is also an emergency. Similar to this atresia, that is the pulmonary atresia, there is a thing called duct dependent systemic circulation. That is when the heart is very small. The left side of the heart is very small, the aortic arch is very small, and the aortic valve is very small. So in these cases, the same shunt, that is the PDA, it supplies the lower body of the baby, and that is also a situation which is emergency. That is called the hypoplastic left heart syndrome. So the hypoplastic left heart syndrome is by far the most difficult to treat congenital heart diseases with not very good outcomes. Apart from it, the ASDs, VSDs, PDA, tetralogy of Fallot, transposition of great arteries, all these diseases are completely curable and with an excellent surgical or interventional results. Basically, these holes of the heart, that is the ASD, VSDs and PDA, those are treated by microsurgery or what we call as the balloon surgeries or the device surgeries, after which the baby becomes absolutely normal for life. Apart from that, there are some diseases like there is a small aortic valve or there is a small pulmonary valve. Those are the valve problems of the babies, in which either the pulmonary valve is very small or the aortic valve is very small. If the aortic valve is very small, that puts a heavy weight on the heart, heavy stress on the heart, and heart is not able to properly pump to the body, for which a balloon surgery is necessary to increase the flow to the body. So once the flow is established, the baby will be able to lead a normal life. And continuum of this Small aortic valve is the coarctation of aorta. Coarctation of aorta is that where the main artery, which is the aorta, which supplies the whole body, that becomes narrow. If that becomes narrow, again the whole pressure is on the heart and heart is not able to pump the blood to the body properly. So in that cases also, the small tiny area, that is the coarctation of aorta, it has to be dilated by a balloon. And if not a balloon, the baby, if it becomes bigger, we can even stent that side so that the flow becomes normal. And once that flow becomes normal, the child is absolutely normal for his age, can perform all the activities and grows along very well. So these are the basic ASDs, VSD, PTA, tetralogy of Fallot, transposition of great arteries, and the valve problems. There are some complex congenital heart diseases that we call as a single ventricle. That means the hole from the lower side of the heart is so big that it almost is like a single ventricle. Single ventricle is one such disease which is not completely curable, but it has still a surgery which is called a Fontaine operation, after which a child can lead a healthy life at least till 5 decades of age. Those are a little complex surgeries, need multiple surgical options right from the day one, from the baby is born, to a second surgery which is performed at 6 months of age, to a third surgery which is performed when the child becomes 6 years of age. That is called as a single ventricle palliation pathway. So 50 years back, there was absolutely no treatment for this particular condition. But as science has progressed and we have been lucky enough to get options for this kind of diseases. Thank you.